For me, personally, I feel as clinicians transitioning into becoming healthcare leaders, 50% of the job is done. We have the experience, we have the clinical knowledge, we have what it takes to build relationships with key stakeholders, our doctors, our nurses, our hospital teams. That is something that we already have. The other 50% for me is finding the gaps. So for me, making that transition, I never planned to do what I'm doing currently. I was having a conversation with some of the panelists and some of the other speakers earlier about what my goal was when I went to medical school, and that was to be a pediatrician, period. That is what I intended to do. But of course, circumstances changed, things changed. But what sort of led me to that transition was that sense of fulfillment when you identify a gap in the system, or when you find a problem and you're able to solve that problem from an operational perspective, and to be able then to have that common goal. So you do it with your team, you do it with your stakeholders, and achieving that common goal for me is what gave me that fulfillment. And it started off with small wins, fixing little processes in the system, just within my department to begin with, and then moved on to a bigger scale of making these changes. And the wonderful thing that I can say now in a healthcare management role is that a lot of us go out and do medicine with this goal of creating an impact, whether it's on one patient, 10 patients, 100 patients. But in a leadership role, you're actually able to make that impact much larger. And not just for patients, but for employees, with your business partners, and that impact for me is very rewarding. And how do you do that? For me, it's identification. That's very important. And that process of identification is not easy. There's a lot of communication involved, and sometimes doctors can be not the best communicators, I have to say. We're so focused on getting our jobs done that we forget the importance of communication. So if you look at the importance of communication, identify your problems, identify your gaps, I think that's the other 50% done to become a good healthcare leader.